Good afternoon. How you
Hey,
doing, sir?
I'm doing all right.
All right, all
I'm about
right,
to
all
get
right.
ready for you right now. How you doing? How
I'm
you
doing
doing?
okay. I can't complain at all.
That's good. That's good.
All right, good deal, good deal.
Yes, sir. You hold on for one second. All right, ladies and gentlemen, it's time now for the health test with the Dr. Brown. Stay tuned here at WVOE 1590 on your dial.
All right, all right. Thank you for that introduction. As always, good afternoon, listeners. Welcome to another exciting episode of Health Facts. You're you're locked into WVOE, the voice of Ebony, where your health is our heartbeat. I'm Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. All righty. So thank you all for tuning in yet again. Yet again, we find those health topics that really matter, and we try to get some information out to you so you can not only be aware of what's going on from a health perspective, but also so that you can know what to do about it. We want you to be able to know about it and be able to do something about it. Okay, so that's what we do here at Health Facts. Okay, so this time we're going to be talk about. I had another topic in mind, but as I was kind of doing some research for this session, come to find out, October is Breast Cancer Awareness Month. Okay. Breast Cancer Awareness Month. October is Breast Cancer Awareness Month. And so I was like, oh, let me switch up a little bit. So I know I'm a hypertension guy, health and wellness, the whole nine yards. But breast cancer is a very important topic. And since this is October 1, it's the first day, we're going to go ahead and get started with a little bit about Breast Cancer Awareness Month. So I got a few facts together, and of course, I got some clinical as you live through life, you get to see some of this stuff. So I wanted to bring this topic to you so that you can know why breast cancer is important and what you can do about it, be a little more familiar about it. Okay. For me on a personal level, like I said, I have multiple family members that have experienced, breast cancer. We had one of my relatives that actually, she really, I mean, she had it for years because she found it relatively early, got the treatment for it, and kind of followed up and was able to really battle it. I mean, she was really able to battle it. Now, that over time, it did catch up, but this is after like really decades of being able to battle this disease. So today we're going to talk about what breast cancer is, who it affects, and the steps you can do to kind of protect yourself and your loved ones. Okay. So we're going to start this out. So, yet again, like always, we start out with what is breast cancer. So breast cancer happens when cells in the breast grow uncontrollably and basically form a tumor. Okay. So some, if it's a tumor, like and it doesn't spread, it may be harmless, but a lot of times, anytime you get a clump of cells in a place where they're not supposed to be, this is all you're always concerned about whether or not it's dangerous or not. Okay, so there are a couple of different types of cancers. So there's what we call, and I'm gonna use these are gonna be some fancy names. I'm just gonna put them out there. But like there's ductal carcinoma in situ. This is usually early stage, usually detected on a mammogram. And like I said, it's kind of more of an early stage. And then we have an invasive ductal carcinoma. And this is usually starting in ducts. And some of this stuff is going to require, kind of a knowledge of how the structure of the breast as well. And then there's an invasive lobular carcinoma that starts in the glands that make milk. Because remember, these are breasts, as breast tissue, and the purpose of the breast is to make milk to feed children. So that's the purpose of it. So like I said, there are several different types of cancers that can form inside of the breast. They each have their own special name. And like I said, ductal carcinoma in situ, invasive ductal carcinoma, and invasive invasive lobular carcinoma. Those are kind of the three names you may hear. And so at least if you hear about it, hopefully you don't hear about it. But if you hear about it in the future, like I said, you'll at least, oh yeah, this kind of rings a bell. Okay. So now cancers typically are staged. So, and this is for most cancers. If anyone gets hopefully you never get one, but if you do, or if you know someone who gets one of the first things that they're going to do is they're actually going to try to stage the cancer. And that is to understand, exactly, how far it's basically spread and how controllable it is for the most part. So the staging goes from 0 to stage 4. Okay. And 0 is like usually very early, usually hasn't spread too far or anything of that nature. And so, and a lot of times if you can catch it to that stage, it's sometimes, it's almost curative if you can get it caught kind of super early. Stage 4 usually means that it's spread to other parts of the body. So these are the cancers that have kind of gone well beyond, the original organ that they're in. And so once it's found, they're going to stage it, and that'll determine, what sort of treatments are needed, and also longevity, like the likelihood of you dying from, that particular cancer. Okay. So, all right. So let's talk a little bit about, the numbers. Okay. So, in terms of how common this is, right? So 1 in 8 women in the US will be diagnosed with breast cancer in her lifetime. Okay. So as an estimate, nearly 300,000 women will be diagnosed this year. So like I said, this is a very, very big issue. And Black women are 40% more likely to die from breast cancer than white women, even though they are diagnosed slightly less often. So, i.e., more women will be diagnosed, more white women will be diagnosed, but Black women are 40% more likely to die from it. Okay. And there are a number of factors that go into this. So this is why we try to get this message out here, try to get the screening done, try to let people understand, that this is really important. And the earlier you get diagnosed, the more likely you are to be able to survive for a longer period of time, or to get it treated altogether. Okay. Okay. And all right, this is one thing I want to let folks know. And this is one reason, because I usually talk about guys, of course. So one of the things I want to let you know is that, men can also get breast cancer. And this is something that a lot of people do not know, is that men can get breast cancer. And it's rare. Don't get me wrong, it's rare, but so the estimate for this year is that about 2,800 men will be diagnosed with breast cancer, and about 530 will die from this. And one of the things that happens is that because men don't expect it, these cancers are usually found later, and that means that they're going to be at a higher stage. Okay, so this is not just a woman's disease. This is a disease that can, because remember, and this is another thing, because a lot of people don't realize this either, and that is that men have breast tissue. And so, like I said, as a matter of fact, if hormones are off a little bit, men can develop something called gynecomastia. So they literally start growing breast. So that is a physiological thing. But because that tissue is in there, guys can also get breast cancer. So it's not just a woman's disease. Okay. All right. So the next thing we want to talk about, of course, is some of the risk factors. And risk factors for a lot of these, unfortunately, for a lot of these sort of disorders are going to be kind of similar. Family history is huge. So if you got family members that have breast cancer, that increases the chances of you getting breast cancer. Also, ovarian cancer is another one. So breast and ovarian cancer are two things that you want to look out for. If it's in your family, then that increases the need for you to get screened for breast cancer. Matter of fact, you might want to get screened a little bit earlier. Also, there are certain genes mutation. There's a BRCA1, BRCA2. those are some important factors. So if you have a family member, like say that your mother had it and she got diagnosed and found that she had BRCA 1 or 2, then like I said, you may want to get yourself tested because that's going to increase the chance of you getting breast cancer. Older age, and then some of these other things are more non-specific, stuff like obesity, lack of physical activity, alcohol use, smoking, and radiation exposure, of course, also are there. For men, risk factors are family history yet again. So if you got a family history, men, you want to be checking your breasts as well. The BRCA gene also pops up there. There's something called Klinefelter's is there, but then you also have stuff like the radiation exposure, obesity and stuff of this nature that can also increase your risk of developing breast cancer as well. Okay, so fellas, I guess ladies and fellas, I guess if you notice a lump, nipple discharge, changes in your chest, don't ignore it. Okay, so get that stuff checked. So just because like we tell the women this all the time, but for guys, same thing. Like I said, if you feeling down here and it feels a little weird, or you feel a little knot, get that stuff evaluated. Okay. All righty. So now we want to talk about, so we know what it is, risk factors for it. And now what do we want to talk about? We want to talk about, how to screen for this. We talk about this with a lot of other conditions. You want to get screened for this. And yet again, this is where I go into the primary care. I have a book about primary care. Like I said, the fact that you want to get this stuff started out early, that you want to get your primary care doctor early. And yes, I'm a specialist, but I believe in primary care because that's where your health starts. That's where your medical care starts. Well, starts at home, but your entryway into medicine is through your primary care clinician, your primary care doctor. And so screening is where this stuff goes in, right? So screenings are critical. I'm going to reiterate this: the earlier you find this, the better the outcomes are. So for women, mammograms starting at age 40, get them every 2 years. You want to get clinical breast exams by a doctor or nurse. Yes, there's a clinical breast exam. So, we have a method for how we evaluate the breast, and we check to see if there's any lumps, bumps, or discharge that are in the breast. And so you should be getting clinical breast exams by your clinician. So your primary care doctor, if you have OB, they can do that as well. So just make sure that you ask them and make sure that they're doing your clinical breast exams. Your mammograms, those are imaging tests, and that should be starting at age 40, be done every 2 years. Or more frequently, just up to whomever your clinician is. Okay, and then self exams, and pretty much every month. And if you start early, you'll know your body, so when things start changing. When you get a lump that hasn't been there before. Get a little something that might be the start of some discharge, something of nature. So all that stuff is what you want to do. So these are evaluations and screenings. Like the self-exam is absolutely free. You can start that at any age. Like I said, even when you're younger, when you first start developing breast, that self-exam can start even then. And then, like I said, self-exams for men, also same thing. These are no-cost exams. And like I said, if you find something that's a little abnormal, you can go to someone and have it evaluated. The clinical breast exam. So, like I said, you make sure get a primary, and the primary should be comfortable with doing the breast exams. And then, of course, at age 40, you want to make sure you're getting those mammograms done. Okay. And then there are also some, and depending upon your risk factors and whether or not it's things in MRI and the mammogram, you can also get an MRI. These are usually for people that are at high risk and have strong family history, so it's a little bit more specific. Okay. So, and when I say starting mammograms at age 40, that's for the general public. So now if you say, hey, my mom, my aunt, all of them had breast cancer, you can start earlier. Okay. You always can start earlier if you have family history or some sort of clinical reason for doing that. So when we make recommendations, as we have, certain organizations that make recommendations, those are recommendations and they're for the general public. However, remember, as a physician, we have an oath towards our patient. So if there is a clinical reason that we think that you need that earlier, maybe 35, 30. You say, hey, my mom, developed breast cancer at 35, and so did her, and her sister developed at 38. Then you don't want to wait until 40. You might want to get yours at 35 or even 30. Yet again, talk to your clinician and see if you can get that done, because yet again, that family history is always important. We've kind of talked about this before. Okay. Now for men, there really isn't a screening guideline. But if you have family history or high risk, you can, talk to your doctor, talk to doctor, nurse practitioner, PA, and see when you think you should have this stuff done. And yet again, do your own self checks. Press around the breast. You actually, you should be, and there's actually a screening method for doing this. So you're going to press around the breast area. You want to check up on your armpits because you want to see if there are any lymph nodes, and up here in the neck as well is how that is done. But there's an actual technique for how you do these self checks. So whether you're a man or woman, there's a way you can check your breast. I guess for men, checking your chest to make sure that there's no changes that are going on there. Okay. All righty. Okay, and for the most part, like I said, and definitely for women, like there is a recommendation that you do, kind of monthly self-exam. So like I said, you can set a reminder on your phone to do that once a month. Maybe do it on the first of the month, maybe do it on the last day of the month. But you want to make sure that you're doing that. If you're, guys, if you're married, you like say, hey, you might want to check your significant other, wife, and make sure that that they are doing their exams as they're supposed to. Okay. And yet again, for the self-exam, like I said, it's kind of like you take the pads of your fingers and you actually do circular motions around the whole breast, kind of up to the collarbone and down into the armpit. And you can actually look in the mirror, because you want to see if there are skin changes, dimples, nipple changes in the nipple, anything that nature that just looks a little different. Okay, and anything that looks a little unusual, report it, and the clinician can then do a clinical exam, and then if indicated, can also do mammograms, MRIs, further imaging if needed. Okay, all right. So now we've talked about what it is, how important it is, who can get this. We talked about how to screen for this. Okay. In terms of, full diagnosis, of course, usually they do like some more imaging, and that will get you more imaging. And at some point in time, you have biopsy, or you have to get a piece of that tissue to actually look up under a microscope to confirm that this is breast cancer. So there will be a more invasive test at some point in time if they find anything that is suspicious. Right now, once you get found, once they confirm that it's breast cancer, they get the staging, then they have to do, then we have to do treatment. Okay, then treatment has to be done. And so depending upon the type of breast cancer it is, and we talked about some of the types, and what stage, and we talked about stage. So like I said, the staging is, the 0 to 4, and that kind of determines how far spread this is. That's going to determine what sort of treatment you're going to get. And so this is usually done by an oncologist or actually a lot of times with breast cancer, they have people that specialize in the diagnosis and treatment of breast cancer. So they usually have some specialists that are doing that. But and some of the treatment options that you may be offered are going to be surgery, which is removing the tumor or some of the breast tissue. So like I said, that may, let's say, depending on how early it is, that may be what you need. If it's spread out a little bit, they may offer you radiation therapy. And like I said, that kind of destroys cancer cells with some really high energy and focused rays that you have there. There's chemotherapy. I think most people probably have heard about chemotherapy at some point in time. And that's a drug that's used to kill cancer cells kind of throughout the body. And then sometimes it's what we call hormonal targeted therapy. That's more personalized, more precise is probably the best word to use for that. And so you got all those things that are used to treat breast cancer once it is found. And like I said, that is determined by your cancer team once they have, once you've gotten screened, diagnosed, and they know exactly what this is and where it is. Okay. So that's it. So, and one thing though, and I've said this multiple times during this one, you've heard it probably, in other people's presentation, and that is, remember, the earlier the diagnosis, the more options are available. The earlier the diagnosis, you want to find this as soon as you can. So if you get like a lump now, you don't want to wait 2, 3, 4 months. You want to get somebody to take a look at this. Hey, oh, you know what? I feel something right here. It feels a little weird. Go ahead and get somebody, get on a schedule, make an appointment so that somebody can do that clinical exam, help localize and figure out what's going on there and determine if further imaging is needed. Don't try to, because a lot of times people are in denial, and especially if you've had family history, because sometimes what people do is because, they do these weird things with their mind where they don't want it, or they associate this is how my mom started out and then she died, like 6 months later. And so because of that, you can actually, what do you call, psych yourself out and make yourself not want to go get this done. No, if you notice a lump, if you notice a discharge that's not right, then set your appointment and follow through with that appointment so you can have somebody else that can take a look at this and see what's going on there. So there are other things that can go on, like their infections, stuff of that nature, that can also happen. But what you don't want to miss is the cancer. You don't want to miss being able to get this treated early and increase your survivability. Okay, so you don't want to do that. All right, cool. So we got that. All right, so and kind of like we said, risk factors, like I said, family history is the biggest one, because that really does tell the tale. And family history, you're going to hear this over and over again. So for so many of our medical disorders, if your family had it, that increases the chance that you may have it. So you want to be aware of that. Okay. And in times like this, and again, I go back to this whole concept of, when you have family members that have this and you've kind of seen it and you've seen the grittier side, the uglier side, and maybe you were a primary caretaker, don't underestimate the ability of that, really trauma to impact how you think about your own body and what you do, okay, and what you're scared of, what you don't want to do. But you also want to remember, like I said, this is a Christian station, so we always want to remember that, and in times of illness, faith and community can give us strength. And so that you always have to have faith, because whatever's going on with your body is going on. Okay. And you want to have faith that you can take care of this, but you don't want to have what faith without works. So your work, when you find something, is to set up an appointment and follow through. It's not to talk yourself out of it. It's not to listen to your own counsel. It's to set up with your community and give you a little bit of strength, a little bit of insight that's going on there. Okay. And just remember, Isaiah 41:10, do not fear, for I am with you. I will strengthen you and help you. Okay, that's all that stuff is in the Bible. Okay, so breast cancer awareness, just remember, breast cancer awareness is not just about medicine. It's about lifting each other up, having that faith, not being afraid, and spreading knowledge and empowering each other. And that stuff really does save lives. Okay, it really does save lives. So so that's kind of the overall talk for today. So what I want to do, I want to leave you with kind of a call for action, a next step. All right. So if you're a woman that's age 40 and older, schedule your mammogram. This is October. This is Breast Cancer Awareness Month. So if you're 40, 40, and 40 is no longer the new 30, 40 is 40. Okay. 40, schedule your mammogram this month. If you don't already have it done, schedule your mammogram this month. Now, if you're younger than 40, learn your family history. And you want to, if you find out you have family history, oh my God, you got like four family members that passed away from breast cancer, then you want to talk to your primary clinician about possibly getting earlier screening. So you want to make sure you do that. Then the other thing is, if you're younger than 40, you want to make sure you learn how to, and you start doing monthly self breast exams. So do those at least once a month. Guys, if you're, like, say, hey, we're not forgetting you this time, okay? I know it's pink, I know it's breast cancer and this nature, but do not neglect this either. Check yourselves too, especially if you have family history. So make sure you're checking, make sure you're doing your self exams as well. And like I said, you check up on them armpits, see if you got any lumps up under there, because that's where those lymph nodes are. Check up in that collarbone, that lymph nodes up there. Make sure you check all this stuff and check and make sure that you don't have anything that feels like a little lump, feel like it doesn't, that's new, that doesn't belong, or that you've got some discharge, or just skin discolor. Maybe the skin is discolored, or maybe it's tinted in a little bit. Like I said, you're trying to figure out like why you have a dimple on your chest or your breast. Like I said, those are warning signs. Okay, so make sure you get it checked out. All right. So I want you. So like I said, a woman 40 and over, schedule your mammogram. If you're under 40, find out if you have family history. If you have family history, talk to your primary about getting screened earlier. Even if you don't, and for everyone under the age of 40, you want to start learning how to do monthly self breast exams. Men, don't forget about this either. And I want both men and women to share this message with someone you love. Okay, share this with family, with friends. Heck, share it with strangers, and continue this good work, because we want to make sure that we get this message out here. We want to make sure we get early diagnoses. We want people to like say, our preference is for you not to get breast cancer at all. But if you do get it, we want it being found at an early stage, so you have maximal treatment options and you have increased chances of surviving from this disease. Okay, so yet again, thank you very much for tuning in. There are a couple of, if you want to get a little bit more information, maybe some resources. There's the American Cancer Society. You can look that up on Google. There's a National Breast Cancer Foundation. Yet again, these are things you can look up on Google if you want to. We'll probably put it up in a post as well. But like I said, right now, I'm just trying to tell you the name. So American Cancer Society, National Breast Cancer Foundation, and the Susan G. Komen Foundation. These are ways that these resources can get you more information and can possibly get you into resources. Also, another thing, if you, for those individuals that may not have insurance, look around. Like you may want to talk to your public health department to find there. A lot of times there are programs that can get you a free mammogram. Okay, so don't let the lack of insurance or the fact that you can't afford it stop you from getting this. Go seek some resources. I always tell people to start in the public health department. The health department has resources that can get you plugged into a lot of different places. Okay, so yet again, thank you for your time. Thank you for your attention. Please sign up. Please follow my page, and stay with us. Tune in with us for next week. Yet again, and tune in to WVOE, the voice of Ebony, as well, for those people listening to us on the radio. We appreciate it as well. And until next week, just remember, your health is your wealth. Thank you very much.
All right, ladies and gentlemen, there you have it, Dr. Brown here at WVOE. I'd like to thank him for calling in on this afternoon to speak with us. We're going to continue here at WVOE. Time now is 12:42.